Dr. Ken Landau. Thanks for watching. Let's talk about minocycline. Now, minocycline is an antibiotic. It's a semi-synthetic derivative of tetracycline. The drug was patented in 1961. It's been on the market in the United States since 1971. And in spite of the fact that it's an old antibiotic, there are more than 2 million prescriptions written every year for this drug. And remember, because it's an antibiotic, it's not of any use for the common cold. It's not useful for the typical sore throat that's due to a viral infection. It's only good when you have an infection with a susceptible bacterial organism or to prevent an infection with a susceptible organism. So for the most part, minocycline is used for treating acne, also used for other skin and subcutaneous infections, could be with methicillin-resistant Staph aureus, the MRSA, could be a problem with an abscess or cellulitis, could be a pyoderma, sometimes used for rosacea and perioral dermatitis, and those abscesses that can develop under the arms or in the groin, we call that hidradenitis suppurativa. Can be used for sexually transmitted infections, typically either gonorrhea or syphilis or chlamydia. Can be used for urinary tract infections, typical infection with E. coli. Can be used for certain respiratory infections, but again, respiratory infections tend to be more viral than bacterial. But when they do result from a bacterial infection, maybe a bacterial sinusitis, pharyngitis, tonsillitis, then sometimes it might be appropriate to use minocycline. Non-gonococcal urethritis from ureaplasma, respiratory infections, pneumonia caused by the mycoplasma pneumonia, walking pneumonia, might be an appropriate antibiotic. It also is good for a variety of, fortunately, rare bacterial infections like the organism that causes the plague or cholera or brucellosis, the organism that causes Rocky Mountain spotted fever, typhus, Q fever, psittacosis, anthrax. But for the most part, it's used either for acne or for gonorrhea or syphilis, or used for one of those other sexually transmitted infections, and also used for Lyme disease, and also could be used to treat asymptomatic carriers. Asymptomatic, remember, asymptomatic carriers in the nasopharynx of the organism that causes meningitis. The bacterial organism Neisseria meningitidis. If you're asymptomatic carrier, this might be an appropriate antibiotic, but there's an increasing amount of resistance. If you happen to have Mycobacterium marinum, it's a relative of the tuberculosis bacteria that you can get from certain water environments, including your fish tank. Well, it might be an appropriate antibiotic taken for a long enough period of time. It's useful for a wide array of different gram-positive, gram-negative organisms. There's significant cross-resistance. So if an organism is resistant to tetracycline, for the most part, it's going to be resistant to doxycycline and minocycline. However, it seems that the doxycycline and the minocycline are still relatively good antibiotics for methicillin-resistant staph, whereas tetracycline by itself is not. Well, we decide whether an organism is resistant or not from laboratory examination, where we use a dilution or diffusion technique. That tells us whether the antibiotic is going to be good. But for the most part, it seems that for acne, that all minocyclines are pretty much the same. And as a matter of fact, when we look at several of the tetracycline family antibiotics, they all seem to work about the same. There's no evidence that it should be considered a first-line therapy. Actually, one drug company sponsored randomized controls trial showed that topical erythromycin and zinc were even more effective than minocycline. There have been no trials where minocycline has been tried to use in conditions where the acne organism is resistant to other antibiotics. And there's no evidence that the much more expensive extended release minocyclines seem to have any advantage. Actually, they just cost a lot of money, but they don't provide any further benefit. Now, the antibiotic is what we call bacteriostatic. So it can slow the growth of the organism, stop the growth of the organism, but it doesn't really kill it. It depends on your body's immune system to do that. Penicillin, on the other hand, kills the organisms. So you don't want to combine the two antibiotics together. You might detract from the benefit you would get from the penicillin. Now, the way the drug works is it inhibits the protein synthesis of the bacteria, and it directly induces, or inhibits the induction rather, of nitric oxide synthase. Well, it gets confusing because the antibiotic also has a variety of actions independent of its antimicrobial activity. So it works as an anti-inflammatory, an anti-apoptotic, anti-cell death, particular kind of a product. It inhibits protein breakdown, it inhibits the formation of new blood vessels, might inhibit the metastasis of certain tumors, inhibits bone resorption, and as a result it can be used to treat conditions where the immune system seems to be involved, like certain types of dermatitis or periodontitis or even atherosclerosis or certain autoimmune diseases. It works as an antioxidant. So it decreases the cell death, decreases what we call apoptosis, by upregulating the anti-apoptotic gene BCL2. It seems to decrease the neural cell death. It decreases the production of certain cytokines. It decreases the activation of certain substances inside the brain, the microglial cells. Seems to decrease the MMP that break down the connective tissue, decreases the production of reactive oxygen species, free radicals. It decreases the T cell migration into the brain. It seems to have some activity in the mitochondria where it decreases the calcium overloading and stabilizes some of the mitochondrial membranes. And as a result, it's been experimentally used for a wide array of conditions, from traumatic brain injury to neuropathic pain and sciatic neuropathy and inflammatory bowel disease and diabetes and cardiac ischemia and sarcoidosis and pyoderma gangrenosum and diabetic neuropathy and certain types of asthma. It's been a staple of treatment in rheumatoid arthritis because it's an immune suppressant, although the 2015 American College of Rheumatology guidelines don't include the drug. It's been used to treat schizophrenia, where it can decrease some of the negative symptoms and the total symptoms. Seems to be neuroprotective, working as an anti-inflammatory agent in people with multiple sclerosis or Parkinson's disease or Huntington's disease or even Alzheimer's disease. And in some cases, it may work as an antidepressant. Seems to cross the blood-brain barrier. So it's neuroprotective in certain conditions where traumatic brain injuries or stroke or spinal cord injuries. As I mentioned, it also seems to work in certain cases of Huntington's disease or Parkinson's or multiple sclerosis. Use as an antidepressant goes all the way back to 1996, but in Lou Gehrig's disease or amyotrophic lateral sclerosis seems to make the condition worse. We don't know what the appropriate dose would be. The standard dose that's been tried in stroke is 200 milligrams a day, but some people have used 200 to 400 milligrams intravenously twice a day. Use that for about a week in people who have spinal cord injuries. In animal studies, the evidence suggests you might need a much higher dose, somewhere between 3,000 and 7,000 milligrams. Now, all of that is experimental. None of that is routinely used for humans. Now, the drug can cross the placenta, gets into the fetal tissue, and might cause some harm to the fetus, especially the teeth. So it's not used in the last half of pregnancy or in infancy or up to about 8 years of age because it could stain the permanent teeth, stain them a yellowish, grayish brown. Now, usually that occurs with long-term treatment, but sometimes it occurs with repeated short courses of therapy, and it can stop the enamel from being made, a condition we call partial enamel hypoplasia, and it seems to be toxic to the developing skeletal tissue. And as a result, you can get some congenital abnormalities, limb reduction, especially in children born to mothers who've been taking doses of this for protracted intervals. Seems to cause some decrease in the growth rate in the preemies if the mother has been taking the drug, but it's reversible on the discontinuation of the medication. Pregnancy just shouldn't be used unless it's the only choice available. Since it's excreted into breast milk, it's not good for women who are nursing. Pediatrics, well, shouldn't be used in children. In the United States, they say less than 8 years of age. In Canada, they say less than 12, 13 years of age. In geriatric populations, certainly very frequently used, but you have to remember that because there's decreased function of the liver and the kidneys and the heart, probably start at a relatively lower dose, should not use the medicine in people who have myasthenia gravis. Seems to cause harm in ALS or Lou Gehrig's disease. If a person has severe renal, severe liver disease, got to be careful of the drug. In people who are pregnant, obviously not appropriate. Even if a couple trying to conceive, male or female, there's potential harm. It can harm the spermatogenesis. Certainly in the animal models, it decreases the number of sperm, decreases the motility of sperm, causes morphologic abnormalities. The sperm look funny. Contraindications: shouldn't use the drug and take an excessive amount of alcohol. In different countries, especially Australia, there's a medicine known as methoxyflurane. It's called the green whistle. It's a non-opioid pain reliever that's used by paramedics and emergency room doctors in people who have acute injuries, acute pain. But unfortunately, the combination of the two, well, that can cause fatal renal toxicity. Shouldn't use it, obviously, if you're hypersensitive to the tetracycline family. Now, it may cause some resistant organisms to overgrow, and then if you take the drug, even though you're treating one infection, it might lead to inflammation or infection, overgrowth of organisms in the mouth or in the vagina or in the anus. Can cause some people to develop a staph gastroenteritis. Well, once you take the drug, it seems that the peak in the system is somewhere around 2 hours, although it ranges anywhere from 1 hour to 4 hours. The half-life of the drug averages out to be about 15 hours. So in some people, it's metabolized relatively rapidly. Half-life is only 11 hours. Some people, relatively slow metabolism, 22 hours. Maximum concentrations if you take it with food. But if you do take it with food, it's going to be delayed to peak absorption for about an hour. But you can take it with or without food. If you take it with food, it's going to decrease the absorption by a little bit, by maybe about 10 or 12%. If you take it with milk, on the other hand, it's going to decrease the area under the curve. That means the amount that's in your system by about 33%. And if you take it with milk, the peak absorption is going to be decreased by about 32%. And the absorption is going to be delayed again about an hour. If you have hepatic dysfunction and it's relatively mild, it's not going to do much to the half-life. But if you have severe renal dysfunction, kidneys don't work, the half-life could be extended all the way up to about 70 hours. So you can use it with mild kidney dysfunction, but not with significant kidney dysfunction. And you have to be careful because it's going to be absorbed less completely if you happen to be taking an antacid that contains either aluminum or calcium or magnesium, if you happen to be taking an iron preparation, or if you're taking a bismuth preparation, oftentimes used to treat gastrointestinal ailments or used to treat H. pylori. And if you happen to be taking Acupril, that's a high blood pressure medicine, you have to realize that that contains some magnesium carbonate. Side effects of taking minocycline, relatively mild. Some people lose their appetite. Some people develop nausea or vomiting or diarrhea. Some people have dyspepsia or sore mouth, sore tongue. Some people develop an enterocolitis or inflammatory lesions with yeast, and yeast can overgrow in the mouth or in the anus or anogenital region or in the vagina. Some people get an esophagitis if they don't take the pill with a sufficient amount of liquid, or if they take the pill and then go to bed right away and lie flat. Probably not a good idea. Well, other side effects include lightheadedness and vertigo. Well, because the potential for vertigo that seems to be higher with minocycline than either with tetracycline or with doxycycline. Got to be a little careful when you start taking it to make sure it's okay to drive or operate hazardous machinery. The drug may cause some photosensitivity. It can exaggerate the amount of sunburn reaction that you develop. It's less than with doxycycline, but it's more than with tetracycline. Still, you need some caution if you're going to be outdoors, especially in the summertime. Should not take this drug and then go to a tanning bed. It can cause a fixed drug eruption, a blister that occurs either on your hand or in the genital area or sometimes on your face. Some people develop some alopecia, hair loss. They develop some itching or coughing if they take the drug. Some people can develop a certain kind of kidney disease. We call it interstitial cystitis or muscle aches or joint stiffness. It can affect the blood organs. It can cause a decrease in the platelets that cause clotting. It can increase the allergy cells, the eosinophils. Some people take the drug and develop some numbness or tingling in their extremities. Now, much more so than with other tetracycline products, minocycline has a tendency to cause some ringing in the ears and ataxia and that vertigo I mentioned and some dizziness. You can develop some allergic reactions, a rash or some swelling or difficulty breathing. Some people develop hypersensitivity reactions, especially if they have a history of what we call atopic disease. In other words, they have a history of asthma, hay fever, allergies. They have joint pains that may develop. There's a rare condition that's known as the DRESS syndrome. It stands for drug rash with eosinophilia and systemic symptoms. That can be very severe, can be a fatal condition. Sometimes when you take the drug, even for a relatively short period of time, you can get some hyperpigmentation, some discoloration. And the discoloration can be in a variety of areas. Most people think of it as the skin and the nails, but also can be the teeth or the oral mucosa, even the bones and the thyroid gland and inside the eye and the breast milk. And the perspiration can turn blue or black or gray. Typically that resolves, but sometimes you develop a muddy color. And if you develop that muddy color, sort of an off brownish type color, that can persist for long periods of time. Discoloration can be local or it can be diffuse, especially in areas where you've gotten some sun. And it can occur regardless of the dose and regardless of the duration, although it's much more common if you take the drug for a long period of time, especially if you're taking a higher dose. Now, there's always been some confusion about whether antibiotics may decrease the efficacy or the ability of oral contraception to prevent pregnancy, and the answer is no, that's not really the case. For the overwhelming majority of women who take minocycline, if they do get pregnant, it's because they forgot to take the birth control pill. And as I mentioned, it can cause the overgrowth of some non-susceptible organisms, including fungi. And there's a condition known as pseudotumor cerebri, or we call it benign intracranial hypertension. It's increase in the pressure inside the brain. That can lead to headaches and blurred vision and blind spots and double vision. Usually, if you stop taking the medicine, those symptoms go away. And it seems to be one of the relatively few drugs that can cause a drug-induced lupus-like syndrome. And when you get to the drug-induced lupus syndrome, get some arthralgias and arthritis and joint stiffness and swelling and muscle aches, and you can get fever and you get a rash. Especially occurs in women rather than men. Can affect the BUN and the creatinine, make them both go up, which isn't really a problem if you have normal renal function, but if you have impaired renal function, it could lead to acidosis and increase in the phosphate level inside the system. So if you're taking the drug for a prolonged period, you need to have some kind of monitoring. And in some people, it can cause an overgrowth of a bacteria known as Clostridium difficile, and that can cause horrible diarrhea. It can cause cramps and fever and watery diarrhea, bloody diarrhea. Can cause toxic megacolon and perforation of the intestine. So it could range anywhere from very mild to fatal. Now, you can develop it while you're taking the medicine or even for a period of up to about 2 months after you stop taking the medicine. Now, a lot of people are treated with isotretinoin, used to be called Accutane. But both of those drugs, the Accutane and the minocycline, have a tendency to cause that pseudotumor cerebri, the increased pressure inside the brain. So you shouldn't take the two in combination. So you could take either the minocycline or you could take the Accutane, now called isotretinoin, but you don't take both together. And if you happen to be taking an ergot preparation, like DHE or dihydroergotamine or just ergotamine for migraine headaches. Well, that can cause a condition that we call ergotism, and that can lead to nausea and vomiting and muscle pain and heart rate that's either very rapid or very slow, cause visual problems, so the combination is not worth taking. Also can decrease the plasma prothrombin. That means if you're taking an anticoagulant, you're probably going to have to adjust the dose, and because it's an antibiotic, it kills the bacteria in the intestine, and those bacteria in the intestine cause the vitamin K to be produced. So you have to be a little bit careful with the clotting situation. And as I mentioned, with methoxyfluorine, used in Australia for more than 40 years, also used in the United Kingdom and New Zealand and Ireland. But they stopped making it in the United States in 1999. Actually, the FDA withdrew the approval for the drug in 2005. And remember, that was the one that can cause fatal kidney reactions when combined. Well, the drug may be hepatotoxic in some individuals, and in those people, it can cause an increase in the liver function abnormalities that you would find on routine blood tests, increase in the bilirubin, increase in the ALT or AST. So if a person has problem with the liver, got to be cautious of the drug. If a person's taking other medicines that affect the liver, again, have to be careful. And there was a question about outdated tetracycline preparations. One of the degradation products is known as anhydro-4-epitetracycline, and that drug could be toxic. Well, fortunately, that hasn't been reported for many years, so it seems that it might have been due to a manufacturing process once upon a time. You could overdose on the medicine if you do, nausea, vomiting, some people with dizziness or abdominal pain or hemorrhage into the intestines, hypotension and tiredness, lethargy, acidosis and kidney failure, sometimes even coma. Animal studies, long-term animal studies showed that, at least in rats, could increase the incidence of thyroid tumors, and dogs increase the size of the thyroid gland. We know it's related to another antibiotic known as oxytetracycline. That can cause adrenal and pituitary tumors. Talked about the impairment of fertility in the animals because of it altered spermatogenesis. Fortunately, it's not mutagenic. If you're going to take it for a prolonged period, well, for more than 6 months, the British National Formulary says probably should be monitored every 3 months for your liver function and to make sure you're not developing the abnormal pigment and you're not developing the lupus. Well, we have an extended release minocycline, and the trade name is Solodyn. It's made by Bausch Health, and this drug sells for in excess of $1,000 for 30 tablets. Now, it has an interesting story because when Bausch was around before, it was known as Valiant Pharmaceuticals, Canadian company. And they had an arrangement with a specialty pharmacy known as Philidor. And they would have the reps go in and see the doctors and say, hey, why don't you just submit the prescription to Philidor and they'll fill it and you get the real thing. You won't get any generic preparation. So instead of getting a relatively cheap drug, you got a horribly expensive drug that pushes up the insurance for everyone. And is Solodyn really a super beneficial drug? Is it worth the extra cost of an extended release preparation? And the answer is no. If we look at the improvement in inflammatory lesions, if you happen to be taking extended release minocycline, or specifically Solodyn, well, the percent improvement is going to be somewhere around 40 to 45% versus a placebo, a dummy pill, no active ingredients, 30% plus. And if we look at the percent clearing with the Solodyn, it's going to be about 16% versus about 10% with an inactive placebo. So all you have to do is use some kind of an active acne treatment. It's going to be probably pretty much as good as the Solodyn. And with the Solodyn, there's no change in the blackheads or the whiteheads. Now, Solodyn has a little different activity inside the body, so its maximum concentration is after about 3.5 to 4 hours rather than about 2 to 3 hours with the immediate release product. And it develops a steady state at about 6 days, but the area under the curve, or the amount in the system at any given time, seems to be less with the Solodyn than it is with the immediate release preparations. Immediate release preparations come basically in two forms, 50 milligrams and 100 milligrams, with the Solodyn extended release. And it's only approved for acne, inflammatory acne, non-nodular acne, moderately severe acne. The dose is 1 milligram per kilogram per day for only 12 weeks, and again, only for acne. It comes in so many different forms, 45 milligram and 50 milligram and 65 milligram and 80 milligram, 100 milligram, 105 milligram, 90 milligram, 115 milligrams, 135 milligram tablets. That means that the average person who weighs 120 pounds, well, they take about 55 milligrams a day. If you weigh about 170 pounds, you take 80 milligrams a day. Now with the minocycline, the standard is, all depends what kind of disease you're treating. Typically a dose is 50 or 100 milligrams once or twice a day, typically twice a day. Sometimes start with a loading dose, 200 milligrams initially, then 100 milligrams twice a day for uncomplicated gonorrhea, susceptible organism. Treatment is 100 milligrams twice a day, loading dose is appropriate. Syphilis, it's 10 to 15 days worth of therapy. Mycobacterium marinum, the dose is prolonged. It's 6 to 8 weeks at twice a day. If it's chlamydia, take it for about a week. How much all of this cost? That's always an issue, and minocycline is not an expensive drug. So if you paid for a 100 milligram tablets and you bought 30 of them, well, if you paid cash, it would be between about $40 and $60, but with a coupon like you could get from GoodRx, it would be anywhere between $20 and $30. On the other hand, if you wanted the minocycline brand, it's called Minicin. If you wanted that particular, the brand name product that you could get for $20 if you bought the generic, well, if you want the name brand, it's going to cost more than $1,200 for 30 pills. If you take the Solodyn and you get the generic extended release, well, the cash price is going to be $670, and the coupon price is going to be anywhere between $100 and $170. But if you want the name brand, I want to take the Solodyn. Okay, 30 pills at 65 milligrams. Go over to CVS, it's going to cost you more than $1,300. That's what you can't figure out with the American healthcare system and the drug pricing. Absolutely no basis in reality for the cost of these things. Ridiculous price. That's why we pay so much for our medical care here in the United States. Our drugs are just out of sight. So minocycline, it's a good drug for acne, for skin infections, for sexually transmitted infections, good antibiotic. But remember that it's good for diseases that are caused by susceptible bacteria. It doesn't kill viruses. And the drug might have some effect on the immune system, so experimentally it's been tried for a variety of different kinds of conditions. The side effect profile, relatively mild, but it's one of the few drugs that might cause a drug-induced lupus. And remember, if you're taking it for acne, you should probably take the immediate release form. You don't need the fancy extended release form. It has not been shown to be any better. And as a matter of fact, we would like to keep the duration relatively short. This is not one of the kind of medicines that you take and you just routinely take it like you do with your vitamin, one-a-day products. Anyway, so thanks for watching. If you enjoyed the show, please tell a friend. Consider subscribing so you'll be notified as we post new videos. Appreciate your interest. I'm Dr. Ken Landau.